On this staff edition episode of the ASC Podcast with John Goehle, we provide an overview of quality improvement in the ambulatory surgery center setting and how it affects staff in an ASC.
Welcome to the ASC Podcast with John Goehle, the longest-running podcast specifically focused on the freestanding ambulatory surgery industry. This episode is sponsored by Ambulatory Healthcare Strategies. The ASC regulatory environment is increasingly challenging, but organizations that outsource their regulatory oversight to Ambulatory Healthcare Strategies have an edge. HS works with ASCs to oversee their quality improvement program, run their meetings, develop educational programs, and always be prepared for surveys. For more information or to schedule a consultation, visit our website at ah-strategies.com, email us at info@ah-strategies.com, or call John Goehle directly at 585-594-1167.
Welcome to episode 131 of the staff edition of the ASC Podcast with John Goehle for May 17th, 2021, recording from our studios in Spencerport, New York. This is Susan Cronkite, Chief Researcher for the ASC Podcast with John Goehle and Senior Nurse Consultant for Ambulatory Healthcare Strategies. Joining me is John Goehle, the owner of Ambulatory Healthcare Strategies. John is recognized as one of the nation's leading experts in the ambulatory surgery industry. John is the author of over 10 books on the ASC industry and a frequent industry speaker on regulatory, accreditation, and finance issues.
So one of the things that we try to do with our staff edition is identify topics that would be helpful for staff in the surgery center to understand what's going on in those magical administrative and nursing management offices. And thank you to all of our friends on our Saturday drop-in sessions that kind of give us advice. If you're a patron member of the ASC Podcast with John Goehle, we have this weekly Zoom session with all of our patron members on Saturday mornings at 10 a.m. And during that session, some of the listeners suggested that we talk about quality improvement. So that's what we thought we would discuss today. So let's just start discussing, why is it important? And I think I need to point out that we have to understand that it's a philosophy. It's not a bunch of paperwork. And I know many of our owners believe this, that quality improvement is just, a lot of paperwork. But I think our staff generally understand that it's much more than that. But do they truly understand, or do you truly appreciate the magnitude of all the things that are that go into this, and how you fit into it as a staff person? So that's what we're going to try to do. And of course, I have no idea how I'm going to try to do this in 20 minutes, but we'll do our best we can. And
I think it's helpful when you are the one that's maybe gathering the information and doing a lot of that paperwork, if you know the reason for it, if you see something good come out of it. So, you're gathering the information, and some places don't realize that it doesn't stop there. You have to do something with that information, figure out a way to identify the issues that you're having, and then how are you going to address them?
Well, and quality improvement is central to the concept of high quality care. We know that our centers provide high quality care. What we find in quality improvement activities, though, is a way to prove that, and also a way to continue to improve. None of us are perfect. Well, maybe I am, but no, none of us are perfect. And as a result of that, quality improvement activities help us to identify activities that we could perhaps do better, or things that we could do better. As I said, it's not paperwork, and it's what you're already doing. I say this a lot about nurses. You don't take a lot of credit for all the wonderful things that you do in order to improve quality. And what I find when I walk into a facility and I talk about incident reporting, many people will, especially nurses, will just say, well, I just fix it. Well, that's all well and good, but if you identify a problem, we want to document what that problem was and how you fixed it so that somebody can learn from it in the future. We don't want to have to repeat, that's the whole thing about history is, what is our history and what are the things that we learned over time? That's really what quality improvement is about.
And how do you take that a step farther? Because maybe you're always fixing a certain thing you see, or there's a near miss, and 5 other nurses are also doing the same thing. Well, then you're missing an opportunity to identify, what that thing is, and maybe take a step back deeper into it and figure out how to stop that from happening, or, really identify the root cause of it. So it's just, it's important. And I think a lot of people also are concerned that if they're identifying too much, that they're saying they're doing something wrong, but you're really not. As long as you're fixing it and you're addressing it, that proves good care and that you care about what you're doing and how to improve everything.
I remember an argument I had with one of our owners, one of the owners of a surgery center, who I was explaining to him the importance of incident reporting. And he said to me, John, if I catch anybody writing an incident report, I'm going to fire them. And I said, well, that's not exactly effective quality improvement. And I said, so, of course, trying to be the good cop, to Lori Roderick's bad cop belief. That's we joke about us doing that all the time. I said, what makes you say that? He says, well, we provide high quality care here, and if I identify any problems, I fix them right away. And that it was good for him to kind of put it in that way. So I said, so give me an example. And he said, well, this morning I was walking down the hallway and I saw a dust bunny in the corner. And my cleaning company, clearly dropped the ball on this. So I called them right up on the phone and told them that they needed to fix this and they needed to do a thorough clean the next time. And I said, well, that's an incident report. You learn from that. They learn from that. You want to document the fact that you did that. Writing an incident report. I mean, now, probably really don't want to have incident reports about dust bunnies. but if that's the worst thing that happens there, more power to them. But I use that as an example of how, okay, you found a dust bunny. It was something that would impede the quality of care in your organization. You contacted the cleaning company. You told them what to do. You fixed it. And then you continue to monitor to make sure that doesn't happen in the future. Yeah. That's the definition of a quality improvement activity. Now, that's at the most base level. Of course, really, other activities hopefully are going to be a little more robust.
But using a simple example is that. So if everybody walking down your hallways, all of your nurses are just, scooping that up with a paper towel or something, then nobody ever gets to know that, hey, we need to talk to our cleaning company. There's some kind of a problem here. So, again, that's just a really simple example of it, but that you can extrapolate to, everything else. So you want to be reporting it so you can see where do we need to dig in deeper.
I've been known to do this even when I'm, going to a client. I walk down, I see something laying on the floor. I pick it up, throw it in the garbage. That's good of me to do that, but we really want to identify how that particular issue occurred, and follow through on it. If it's
happening a lot.
And especially if it's happening a lot. So you need to understand that quality improvement provides a mechanism for documenting your quality improvement activities related to improving quality. It should be non-punitive. In other words, we do this to identify opportunities for improvement and without blame, recognizing that it's mostly a systemic problem. And, of course, quality improvement is a major component, if the most major component of surveys. So let's start by talking about the conditions for coverage. In a previous episode, we discussed the Medicare rules and regulations, which are better known as the conditions for coverage. So whenever we're talking about anything regulatory in an organization or an ambulatory surgery center, we always want to refer back to the conditions for coverage and the associated interpretive guidelines. And if you need some more information about that, you might want to refer back to, I think it's episode 129 for more information. Sue, why don't you tell us about 416.43, conditions for coverage?
Okay, so this is a quality assessment and performance improvement. The ASC must develop, implement, and maintain an ongoing data-driven quality assessment and performance improvement, or QAPI program. And the standard is program scope. The program must include, but not be limited to, an ongoing program that demonstrates measurable improvement in patient health outcomes and improves patient safety by using quality indicators or performance measures associated with improved health outcomes and by the identification and reduction of medical errors. And the ASC must measure, analyze, and track quality indicators, adverse patient events, infection control, and other aspects of performance that includes care and services furnished in the ASC.
So in order to carry out quality improvement, there's a number of things that we look for. And I can't possibly, in the short amount of time that we have here and that you have graciously given to us to listen to us, discuss the entire program. But I do want to kind of go over the basic attributes of a quality improvement program. First and foremost is the identification of incidents. Now, it is important to understand that every organization is going to have an incident. An incident isn't always something that's really bad. It's not always a patient that had a fall or was transferred to the hospital. Now, there are going to be those, which we would probably refer to as adverse incidents. In other words, things that involved, sentinel events that involved, some harm to the patient, whether it was, the fault of the staff, which is obviously quite rare, or just a known complication there. Also including incidents would be near misses and the resolution of those near misses. Now, near misses are very important because I'll give the example in cataract surgery. It's not unusual unfortunately, to get into the operating room and realize that you're about to do surgery on the incorrect eye. Now, all of you eye surgery centers have processes in place to do that, but that's still a near miss when it gets to the operating room. And that means that something happened along the way where you didn't prep it properly. And the reason I think that it pops up in ophthalmology so much is because most of the time you're doing both eyes. They're just separated in time. So, and there might be some confusion. Maybe originally you're going to do the right, now you're doing the left or whatever, or some paperwork got mixed up. You want to document near misses simply because you want to be able to say, okay, I caught it in the operating room, but wouldn't it be great if I had caught it a step before that? You always want to be able to use these opportunities, use these near misses to identify a way that you can back it up a couple steps so that it doesn't get to a point in which that it's possible that it would have been undetected. Yeah,
one of our centers, they had a discussion, I believe, at the board meeting where they talked about something that had almost happened, and the doctor just decided, okay, instead of everybody just listening to the timeout, he would repeat back the site that the surgery was to be done on, and just they wanted to prevent it in the future, and they took, like you said, that step back and decided how do we address this before it happens.
So as part of incidents, you're going to be looking for state reportable. Many of the states have state requirements for reporting certain types of incidents. You're also going to identify OSHA and safety, like needle sticks, et cetera. You're going to want to also look at other incidents and occurrences. I like to include in this category things like equipment breaking down. If a piece of equipment broke down during a surgery, that's kind of important. And you want to be able to identify that and what you did to fix that. And keep an eye out. A big part of incident reporting is tracking and trending. In other words, looking at the history of these incidents over time to see if it's increasing. Like if your C-arm is breaking down frequently at an increased frequency, maybe it's time to think about a new C-arm, for example.
Replace it or monitor it more frequently.
Right, or get better repair. Get a better repair organization. Also, grievances would be another incident. Hopefully you don't have a lot of them, but we know that grievances happen depending upon your organization, the types of things, and how much you encourage people to complain. Now, a grievance is a written complaint usually. There are other types of complaints that you might get, like satisfaction surveys. Satisfaction surveys is another thing you want to be doing on a regular basis. You also want to look at cancellations because cancellations tell us a lot. I mean, to have one cancellation in a GI center because the patient didn't go through prep is probably the patient's fault. But if you find that 50% of your patients come in with a bad prep, that's probably the office's fault, or somebody didn't do education properly. And of course, hospital transfers. You should be looking at those hospital transfers. Now, this happens periodically, Sue, where people will say, well, I just transferred the patient even before they went into the operating room. I don't have to show that as an incident, right? No, you do. And this is what I say about that is that if let's take an example. Let's say that you have one incident the entire year where a patient comes into the surgery center and is identified as having being in AFib, and you decide you need to you cancel the surgery, send the patient off to the hospital, et cetera. And it's an incident. You didn't do anything wrong. As a matter of fact, you might have actually saved their life by identifying a situation that could have gotten worse. That is still an incident. Now, one situation is not a reflection, or there probably isn't anything you could do. But imagine a scenario the next week when 50% of your patients, I'm using an example, but 50% of your patients had to go to the hospital. That probably means you're not doing a very good job, or the surgeons of screening those patients
ahead of time,
or
the
high
doctors, blood pressure, high, their blood sugar's out of control. If you start seeing a trend, maybe you need to test a little bit more beforehand.
Right. Ask a lot more questions upon the pre-op screening. So, tracking and trending is a very important part of quality improvement. Looking at the trends of things such as the incidence or infections, et cetera. You want to compare them over time and see if things are increasing at a certain clip. If your numbers are flat, then you probably don't have to do anything. But if you see a rising trend, you're going to want to start working on that. Infection control, of course, is a major part of quality improvement activities. You want to track all of the infections that you do have. You usually do this by asking the physicians to indicate whether any of the cases they performed in a previous month had an infection. You're also going to want to look at sterile processing to identify issues in your sterile processing area. Is all of your equipment working properly? You're going to want to review those logs. Immediate use steam sterilization. Now, of course, I'm old, so I still use the term flash sterilization. But you don't want to be using IUSS if you can avoid it, because that could be an indication that you're taking a little bit of risk in not having proper sterilization of the instruments. And then you're also going to want to do surveillance. There's different types of surveillance depending upon your organization. Hand hygiene is something that all organizations should be practicing. Sharp safety surveillance, infection control, environmental rounds. Those three are like the most basic types of surveillance that you'll have. Also, your state might have surveillance related to influenza reporting. And I guess now, I haven't heard this yet, but I suspect that COVID-19 or coronavirus will be another thing that we're going to report on. Also in your quality improvement, need to make sure that your training is up to date here. Also, infection control requires that you do an annual risk assessment, also known as an infection control risk assessment, or ICRA. Another element of quality improvement is chart reviews and peer review. This is where you either have an outside medical record consultant come in and review your charts or have your nurses review chart audits. Almost all organizations probably should take some time to have nurses review their charts to make sure that they are complete, and review the results and follow up on any trends they might have. Physician chart audits are also required. They're required. Then those are better known as peer review. So you should be doing physician chart audits for both anesthesia and surgery.
And for pharmacy, you might have a pharmacy consultant. It is required in some states and not in others. If you did, you'd have the report of the consultant. You want to keep track of any medication errors. So if you had any, you'd list the errors, any formulary or drug issues or changes, look-alike, sound-alike, or really confused drug names is what they're called now. High alert drug list issues.
Then we should also be looking at patient satisfaction surveys. Now, a lot of different ways that you can do this. The best way is really to hand every patient a patient satisfaction survey before they leave, and then get all that information back. And digest it, follow up on any issues that are identified, and then, find some way of turning that into statistics that tell you how well you're doing. From an environmental standpoint, you're going to want to make sure that somebody is doing OSHA and safety rounds, that they're doing monthly equipment inspections, biomedical testing is up to date, and identify any equipment issues that you might have. What equipment is breaking down on a regular basis, for example. HVAC is always a big issue in ASCs, unfortunately, especially older facilities. You want to make sure that the equipment is working well, that temperature and humidity issues are resolved, that pressure relationships in the rooms are appropriate. So that seems to be a big issue lately in many of the ASCs that I've been going into. The humidity will be outside that range. The proper range, by the way, is 30 to 60 degrees. We'll probably have to have an episode soon when we talk more about some issues on temperature and humidity. There is this perception that you can go as low as 20%, and that is not necessarily true. There's a nuance there, and we can talk about that in another episode. But the proper range is 30 to 60%, depending upon the manufacturer's instructions.
And of course, always remember with that and refrigerator temps, if you go outside the range, you have to make a note of what you've done to fix that or to negate any issues.
As part of your quality improvement, you also want to follow up on fire safety. Make sure all of your drills, you should be probably doing 4 per year, and they have to be scenario based. They should be unannounced. Many organizations really don't take fire drills very seriously, but surveyors are really getting on top of that now. So do a scenario based drill. It's not one of those things where you set off the fire alarm and make sure everybody leaves like we used to do in school. That's not a good fire drill for a surgery center. Emergency preparedness is another part of quality improvement, being prepared for external disasters and internal disasters. I think it's fair to say, we talked about this during the podcast that we recorded during the retreat. We're going to have quite a bit more about external disasters and things that we've learned, but you want to document all of that, all of the things that you've done in your quality improvement activities. And then internal disasters, preparedness, being ready for situations by doing drills. Be ready for code blue situations by doing drills. I also recommend
incapacitated
provider drills. Why can I not say that right? And remember, as part of emergency preparedness, you do need to do an annual risk assessment, better known as an HVA or hazard vulnerability analysis. And the Quality Improvement Committee needs to review that and make changes based upon the results of that. If you are doing radiation safety, like a C-arm, then you need to make sure that you're documenting all of the processes that you have to have in place, the badges and following up on any issues with regard to radiation safety. And to kind of finish up on quality improvement, all of your organizations should be doing external benchmarking, comparing statistics like your infection rate or the number of transfers to the hospital to other organizations, other ambulatory surgery centers, perhaps in your area or nationally. And, of course, QI studies, especially if you are a AAAC organization, you need to do a certain number of QI studies every 3-year cycle. So I hope this has given you a good introduction to quality improvement. I know it's a lot to digest in 20 minutes, but if you do want more information about quality improvement, we have a lot of episodes on quality improvement. And, of course, our wonderful boot camps that help prepare new nurse managers and administrators, depending upon where you are in your career. If you decide that this is something that you're passionate about, I do encourage you to think about some of the other programs that are available. Yeah.
And we always, of course, encourage you to reach out with, any area that you're especially interested in and feel like we could cover more in depth.
Right. We get a lot of our recommendations from our listeners here, for future episodes. Thank you for being a loyal listener of the ASC Podcast with John Goehle. But did you know that you can enhance your experience and support the free podcast by becoming a patron member? Patron members have access to ASC Central, an add-on service at a very reasonable price. Patron members have access to our regular drop-in virtual meetings where you can discuss issues that you are dealing with in your ambulatory surgery center with the hosts and other members. Members also have access to valuable member resources, including a document library with a growing list of resources, including the rules and regulations, guides to maintaining compliance, example policies and procedures, infection control resources, example risk assessments, example committee and governing body minutes, and over 60 disaster drill scenario kits and example forms and checklists. Members also have access to some of the virtual conferences that we have presented, including the Provider Credentialing Conference, which we offered in December 2020. It's a New World Conference in 2020. Infection Control in-Service to meet the challenges of COVID-19, and the ASC Mandatory Education Program, which is a valuable resource for annual education for your staff. Membership helps to defray the costs of producing the podcast, including the research staff, travel costs to conferences, equipment costs, and production costs. For more information, you may visit ascpodcast.com. To become a member, visit ascpodcast.com.
We would like to thank our sponsor, Ambulatory Healthcare Strategies, the nation's leading regulatory compliance resource for ambulatory surgery centers. For more information about their services, please visit ah-strategies.com, email them at info@ah-strategies.com, or call John Goehle directly at 585-594-1167. This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your comments and questions. Please email us at comments@ascpodcast.com.